I have walked out on a pool deck and been like, excuse me. And it didn't go over very well, so I didn't do that again.
No. I would love to have seen that.
Excuse me.
Welcome to Fit2B Radio. Slip on your minimal sneakers, notch your headphones into your ears, tuck your smartphone into your pocket, and take us along for a walk while we talk. Or just grab a cup of your favorite drink and get on the floor and stretch a bit while we bring you all things fitness, core, and diastases recti related.
You guys ready?
Yes.
Yep. All right.
Born ready.
Born ready. I love that.
I love your first one, though, when you're like, I wish I could just say all those things.
I know.
That is so bad.
Hey everybody, my name's Chris Banke. Welcome to Fit2B Radio. I'm the host and I'm here with Beth Learn. She is the CEO and founder of Fit2B Studio, LLC, amazing fitness site. We also have a guest I'm excited to talk to today. His name is Jacob Mearse, and he is a certified nurse midwife, which is it's pretty cool. Not super common to have a guy doing this job. It's a very important job, though. So we're excited to talk to him today, and I would love to just get right in it and get going on this podcast. Jacob, where are you coming to us from right now?
So right now we're in Reno, Nevada.
Okay.
I work in a little Medicaid-only clinic in downtown Reno.
Okay.
And I do all of the women's health services here.
Very cool. Very cool. So are you native Nevada? Did you move there?
Not at all. I actually grew up in Bend, Oregon.
No
Nice.
way.
Yeah.
That's where Chris is.
Bend, Oregon. That's where I am right now.
Are you really? Wow. Well, there you go. I went to Jewell Elementary and Pilot Butte Junior High, and
wow.
then we moved to California for about a year or so, and then I joined the Navy. And I did 25 years in the Navy. Retired last year.
Awesome.
Our last duty station was in Nevada, and so we kind of wanted to stay where we were, and so I took this job here.
Mm-hmm. Thank you for your service. Who is we?
Thank you very much. So we is myself, my wife, April. We've been married 18 years, and our 7 kids. We have 4 boys, 3 girls. Our oldest is our son Wesley. He's 14, and they go all the way down to our youngest Ben, who's going to be 2 in April.
Wow. That is fantastic. So you get the full crew. So you have so with all those kids, you must have lots of free time. Not sure what to do with all that free time, no. I bet. That's very cool. That's very cool. So Navy. So how do you go from the Navy to a certified nurse midwife? I'd love to, how's that?
Yeah, it's kind of a long twisted journey. I was a hospital corpsman / paramedic in the Navy for a long time.
Okay.
Got into a commissioning program where they sent me to college to be a nurse. I was an emergency room nurse, and then got floated up to L&D one day. Said, you're going to cover the labor deck. I thought I was going to hate it up there. And within a few minutes, I was in love. I knew, okay, this is where I want to be. This is what I want to do.
Wow.
But the Navy always has other plans, right? And so even though now I knew, okay, this is what I want, the Navy sent me to grad school, paid for my doctorate. But the fine print in that program is that they have the final say as to what your course of study will be.
Right.
And so I ended up doing mental health for a few years, my last few years in the Navy, knowing the whole time that was not what I wanted to do exclusively. I mean, I love our clients. I love being able to help people, but my heart was always in women's health and labor and delivery. Mm-hmm. And so I went back to school, did a postdoctoral certificate at Frontier Nursing University for nurse midwifery, and well, here I am.
Wow. So how was the mental health? You had your sights set on what you wanted to do. You had to do the mental health. How was that? Did you enjoy that, even though you knew it wasn't ultimately where you wanted to be? But did you enjoy that?
Some days. I guess that's probably true of most jobs. Yeah. I was able, while I was I did my doctorate at the University of Washington, and they have a great perinatal mental health program. And so I was able to really specialize in perinatal mental health.
Right.
There's a lot of connections there.
Yeah,
We
absolutely.
mamas need all the mental health help we can get.
Oh my goodness.
I'll take that, oh my goodness,
Right.
as a yes, ma'am.
No offense to anybody listening. Yeah.
No, none taken.
Right. So I kind of specialized in managing psychiatric medications through pregnancy,
Right.
Postpartum
That's
depression,
tough.
postpartum anxiety, those sorts of things, and got to use a lot of that during my last few years in the Navy.
Right. So it sounds like the mental health part, I mean, correct me if I'm wrong, but it sounds like the mental health part actually tied in well with what you're doing now in a lot of ways. Do you find that to be the case?
I really do, especially here. We're a Medicaid-only clinic, and a lot of our patients come to me with mental health problems, even though they're seeing me now for women's health.
Right.
They're also, within the same building where I work, they're also seeing mental health and psychotherapy. And it's good to have that background to be able to kind of blend all of those things together. And our psychiatrists, can come to me and say, okay, Jake, what do I do? I've got this lady who's, schizophrenic and she's stable on her meds and now she's pregnant.
Right.
Help.
Right. So you get presented with some challenges, and you're able to, because of the experience from both sides, really look at the whole picture and have a good understanding of both sides of the need, so that you can, offer really good support. That's a pretty cool blended skill set. So you are a highly qualified professional that is doing amazing work, and I would love to know, so how did you connect to Beth and Fit2B Studio and all of that? I'd love to hear, maybe Beth, maybe you could talk about how you found this very interesting, highly qualified expert, and how, what we've done in the past together and kind of that. I'd love to hear that.
Yeah. So, we're talking to Jacob for the purpose of our listening audience as if we don't know him, but really we know him very well.
Yeah.
We have to know people pretty well before we let you on our show. But he and I connected through his wife, who was a member of Fit2B, and she was in our forum, and a lovely lady. And she would answer questions sometimes and say, "Oh, I'm going to ask my husband that. He's a nurse midwife," and that really got my attention. For obvious reasons. You don't hear about male midwives very often, and we'll get into that in just a little bit. But just her background, she had really good success with Fit2B, and just her answers. And I could tell, her speaking for her husband, she'd ask him and then she would type his comments. And so, when I started working on the Fit2B Girls course, which is an e-course we provide for girls ages 9 to 14, 8 to 15-ish, girls that are just starting their cycles and want to know more about their bodies from a non-sexual angle, I knew I had to have Jacob contribute to that, because for girls to understand what's involved in their first visit to an OBGYN or midwife, he's the only guy in the course. A lot of people ask, why did you have a guy do that? And the answer is, well, I looked up some statistics, and it's 92% of urologists out there are male. And it's 60 some odd percent of pediatricians are still male, and 58% of gynecologists are still male. So especially in smaller towns, a young girl is most likely to be seen by a male provider, and at some point in her life will be seen by a male provider, and having a female provider is no guarantee of better treatment, sadly.
Right.
So that's how Jacob and I connected, and I happen to know he's a huge Fit2B fan. Jacob, tell us more, though, about you're a male midwife and you think it's awesome. And why is that? And why do you think that's do you think more guys should do this?
I really do. For one, I mean, just numbers wise, when you look at, I'll stick to my world. I'm a certified nurse midwife. So I was a registered nurse first. There are tons of men entering nursing.
Yeah.
But they're almost always, if you look at the statistics, they're almost always steered toward either emergency room or the intensive care unit. Very rarely are men welcomed into areas like labor and delivery, OBGYN, even neonatal nursing. Men are kind of shied away, and that's really, it's really an internal culture thing. I think it's expected. They see I was certainly one of them. They see you walk in the door as a new nurse. You walk in, I walk in, I'm 6'1", 210 pounds. I go, oh, emergency room. That's where you belong. And I think we're missing a huge pool of potentially great midwives who've either never thought about it because they've always been discouraged from thinking, maybe I should be a midwife, or they've been steered away from that by the rest of the nursing and medical profession because, well, that's assumed to be a woman's job.
So it's almost like a reverse sexism, or it is sexism in a way, because they look at you and they see a guy and they instantly think you don't belong in this field. And of course, a lot of people think midwife is a female term, but really quickly for us, can you define midwifery?
Right. I mean, midwife is an old English word, and it just means with woman. So it refers to the gender of the person you're serving, but it has nothing to do with the gender of the person doing that job.
Right.
A lot of my, even a lot of, believe it or not, a lot of my own colleagues in midwifery don't understand necessarily the meaning of that term. I would jokingly be referred to as a mid-husband by other midwives, and I'd have to kind of educate them. Say, actually, that's not really what that word means.
Yeah, you're like, good joke, but bad joke.
That's funny. So so I think you might have actually said this. So you retired from the Navy, or you left the Navy, you stayed in Nevada, and then how long have you been doing what you're doing now?
So I've been a midwife actually a year this week, passed boards and everything else. A year ago this week. I've been in my current job for 6 months this month.
Cool.
So I'm still kind of a newbie midwife, right? I mean, your first 5 years, you're really kind of considered to be one of the new kids on the block here.
Right. So I don't have the statistics in front of me. You guys, one of you probably knows, but so what is the ratio of men versus women in that role, in the midwife role?
So according to ACNM, who's our governing body, the American College of Nurse Midwives, we men comprise almost 2%.
All right.
Of midwives that are members, right? So we're getting there, but there still aren't a ton of us. And in fact, it's still a small enough group that most of us know each other. So if somebody will post on Facebook, hey, this is so and so, there's a good chance I know exactly who that is because I probably talked to that person at one point or another.
Yeah. Yeah, that's cool. I like that. I love stuff that's, where you're kind of blazing new trails. And I like that you're kind of leading the pack there. So you touched on this a little bit, but I'd love to expand more. So why do you feel it's important that we have more male midwives? Like, not just from the standpoint of, hey, there's some good people that could be helpful. Like, why do you see that as an important thing to do?
Right. Well, there's a couple things I wanted to talk about that. One of the big things, and I'm gonna sound like I'm just harping on gender and gender roles in medicine, and maybe I am a little bit, but when you look at what a nurse midwife does, the insane call hours and the incredible amount of responsibility and liability. I mean, the malpractice insurance for midwifery alone is ridiculous.
Yeah.
The salaries don't necessarily match the responsibility and the work hours. And if you look at it traditionally, roles in medicine that are largely female dominated are historically underpaid. When you look at, for example, our colleagues that chose to be nurse anesthetists rather than nurse midwives, they're really, really well paid. And part of that is that there are a large percentage of men that enter anesthesia. And whether we like the fact that this is the way the world works or not, there's still a lot of sexism in medicine. And when a profession tends to be more male dominated, they tend to be better compensated. We have seen statistically, as more men enter midwifery, that salaries have gone up.
Even though it's just sitting at 2%.
Even though it's just
already
sitting at
impacted
2%.
salary.
Interesting.
It is really
You're
interesting.
saying a male-dominated area of medicine, the women in that area get paid more as well. Like the whole area goes up. Interesting.
Right. So female CRNAs get paid, on the same level as their male colleagues. Female surgeons, particularly some of the more specialized surgical specialties, get paid very well. But if you look at, the things that we really need more of in medicine, primary care, women's health, pediatrics, traditionally female dominated and traditionally underpaid.
Yeah. So you said something interesting. You said a governing body, which makes me think of something. So I know someone that I'm not going to say who it is, but there's somebody that's had a lot of children, and now all of a sudden they're calling themselves a midwife. And I don't know what their training is or what their background is, and they certainly are a mom of a lot of kids. But having a lot of kids does not make a good midwife necessarily, I don't think. How is it controlled, or is it controlled as an industry? Can anyone just become a midwife? I mean, you have an incredible educational background.
Lots of education.
But this person, I don't think, has any formal education to be a midwife, yet she's a midwife.
Or calls herself one.
Right. And that varies really state by state in terms of licensure and regulation. I live out here in Nevada where, for crying out loud, we're a state where prostitution is still legal. And in Nevada, you can call yourself a midwife with really no regulation. Right. And this is why it's important that people understand the terms and what we're talking about when we say midwife. The two main groups of midwives that are highly regulated, there are certified nurse midwives like myself. To be a certified nurse midwife, you have to have a minimum of a master's degree. And an increasing percentage of us have our doctorates, and you have to do, roughly 5 million hours of supervised work, and give or take, roughly 5 million. And you have to do a ton of supervised cases, supervised deliveries, pass a rigorous, certification exam, then apply for your state licensure, and you're licensed in most states under the same statute that license nurse practitioners and nurse anesthetists. There are also certified professional midwives, or CPMs. Now, CPMs go a different route of training. They don't start out as nurses typically, but their training is still very rigorous. It is in most states, and I say most states because I live in one of the states where they aren't. In most states, they're licensed and regulated by the state board, either state board of medicine or state board of nursing or the health. Some state body regulates them. And the CPMs actually do, in many cases, more supervised hours of training than the certified nurse midwives do, without all of the academia necessarily that we have to go through. Right. But the CPMs, these are the experts in out of hospital birth.
Okay.
If you're looking for a home birth midwife, more than likely you're going to find a CPM. If you're looking for somebody with licensure and regulation and an appropriate amount of training, in most states they can't write prescriptions. They don't have hospital privileges, but they have certification and experience that is certainly impressive. I have a number of CPMs in our community here that I work really well with. They'll be doing home births, and for example, they'll call me up sometimes and say, hey Jake, I've got this lady, and I think she needs a prescription for bacterial vaginosis, or needs antibiotics for UTI, and they'll send me over labs they've done and say, would you mind seeing this person for a quick visit and prescribing for me? And I'm happy to do that.
Right.
So those are the two basic types. You also have a number of people that will use the term midwife, and there it's a total mixed bag. You don't know what you're going to get.
Yeah.
Some lay midwives do go through a lot of rigorous training and apprenticeship, and they really do know what they're doing.
Right.
Some people, like Chris alluded to, have 5 or 6 babies of their own and say, "Oh, I've got this. I can coach anybody through this." And we all hope and pray everything goes well when they're doing that.
We hope for the sake of their clients that they can.
Right.
Yeah.
Exactly.
Yeah.
So that's kind of scary. So what should someone do? Like, they need to do research, right? Like to know to be safe.
Absolutely. A good question to ask is, first of all, what kind of midwife are you? If you're talking to a midwife and you don't really know, what is what, say, okay, are you a certified nurse midwife? Are you a certified professional midwife? And some basic questions will sort that out really quickly. Like, what hospital do you have privileges at?
Right.
Get a blank stare, then you're probably not talking to a CNM.
Right.
Or how many births have you done on your own?
Right.
Most of us will keep a birth log, because we like to be able to provide statistics to governing bodies and that sort of thing.
Right.
Ask them basic questions. Do you have prescribing privileges? If I need medication for something, can you help me?
Right.
Which is important. I mean, we like to think that we can do the all natural route. But as an all natural person myself, I see a midwife for my well women stuff, but she has prescribing privileges. She's also a naturopath, and she has hospital privileges, and that's important to me. Yeah, because I don't want to have disruption in my care. Just because I might need something she can't provide. I've built a relationship with her. I want to be able to continue that relationship into a hospital or pharmaceutical setting. Right. I want her to know what's going on with me. I don't want to have to see multiple people. So it's really valuable. Now, we did another interview with you. We did a video chat that's on our blog and that's linked here in the podcast, where we went into a lot of details about how you have managed to bring in a lot of basic pelvic floor therapy and exercise prescription into your practice. And so people can go there if they want that angle, that stuff. And there's a lot of content there. So we're not going to rehash that now. Right. I know, Chris, you had a question for him about the fitness angle, right?
Yeah. So we talked about, we touched on it briefly, that you're a big fan of Fit2B. And for those of you that are not familiar with the company Fit2B Studio, we provide an online fitness platform. It's like an online gym where you can do workouts in the comfort of your own home. And we have all kinds, from simple stretching before bed all the way up to really rigorous, like weight training at home and cardio workouts. So we've got everything. You're a big fan. I'm curious, like, how that ties in. Like, what do you see with your patients from a fitness perspective? Why are you a fan of Fit2B? How does it tie in? How do you work with your patients in that way? I'd love to learn more about how that works.
Right. That's a great question. One of the things that I first, noticed about Fit2B, and, Beth was exactly right. I had no idea what Fit2B was until my wife started bugging me all the time. And, okay, there's this question on this forum, and can you help me answer it? And then she kept showing me these videos and directing me to all these articles on this website. And the thing that I love about Fit2B is that, Beth and the other people on there, they're real people. They're not, you're not watching Jillian Michaels on some exercise video.
Bless her heart.
Yeah. I mean, there's nothing wrong with Jillian Michaels, but if you're an average size, average fitness level American woman and you're trying to get in shape, it can be discouraging if you're looking at this person who looks like a stick figure who's, exercising at a higher level than most of us will ever achieve.
Yeah.
And it's so intimidating for people to look at that. I mean, it's maybe the male equivalent of watching Tony Horton do his thing.
Yeah.
Right. Well, it's also not appropriate for the prenatal and postnatal population. The reality is that, you mentioned Jillian, and again, bless her heart, but she's never had babies. And that's a body that is different than my body. And that's a body that can do different things than what my body can do. I've been back to that level before. I mean, after I had children, yes, but there's a progression there that I guarantee she has never explored. And I know because I've researched it. You have to really take things back to basics. You have to completely rebuild the core after having babies. You have to dial it back. It's a different season. It's a different set of strategies to get you back into the things that you love and whatever it is you love.
Right. And I think, correct me if I'm wrong, Beth, but when I look at the Fit2B exercises, the goal isn't necessarily to look like a Barbie doll when you're done.
Right.
We're concentrating on fitness and
function,
ability,
core strength.
Yeah, much more than, do I have this teeny tiny itty bitty waist without any body fat on it?
Right. And we have members that utilize us to get to that place. But most of our people are not even in a place yet where they can even think about that.
Right.
Yeah, you can certainly use the Fit2B platform to get to a very high level of fitness, but the focus is actually more about how do we build someone's strength and core strength so that they can do life better, so they can be healthy, so that they don't struggle with a lot of the things that you struggle with when you don't have that stuff dialed in. And that's a radically different shift from the Tony Horton, Jillian Michaels, get ripped, situation. A lot of times, some of the people that look fit are struggle in areas, have pains in areas, have struggle with their back,
have leaking in areas,
leaking in certain areas. It's not always an indication. It's just like, in the medical, profession, just because someone is really thin and trim doesn't mean they're not just about to have a cardiac event. So there's a lot of things that aren't necessarily super obvious. And so what Fit2B's focuses is more of an overall health, overall core focus, a strength focus, so that you can actually have a decent life. And then, ultimately, the more that happens, you will become more fit. But that's more of a secondary benefit as to being able to have a decent life.
Yeah.
So,
I'm curious to hear, like, from a male and a midwife standpoint, well, the world in general and at large might actually think that guys in general, I know as a woman, I've kind of been trained to believe that men want a scrawny, sculpted, tall, blonde, because that's what we see in the media.
Right.
But set us straight there. From a midwife perspective and a male perspective, why is a functional fitness angle so appealing?
Well, functional. Let's maybe start with from the midwife perspective. That's a little easier, maybe a little safer to answer.
A little safer.
Right. Exactly. From a midwife perspective, we don't care necessarily if you look like a supermodel.
Right.
That's so not what we're focused on. I mean, if through pregnancy, especially, our focus is on healthy mommy, healthy baby, helping mom to have not only a safe pregnancy, but a pregnancy free of unnecessary kind of lifestyle habit-induced discomforts.
right.
We're not going to, hopefully, all of us are kind of on the same page, at least most of us. We're not going to, mom comes in, let's say for her first OB visit, and mom is clearly starting out this pregnancy, over her ideal body weight. Right. I had a very wise older obstetrician tell me one time, so you never have to tell a mom in pregnancy that she's gained too much weight. Trust me, she already knows.
Right.
Very true.
There's really no reason to bring that up.
Nope.
But it's okay to say, you know what, you're going to feel better if you make some changes maybe to your diet and you add some exercise into your regimen. I'm not concerned so much with, body sculpting or how you look, but I want you to feel better. I want baby to get optimum nutrition and mom to get optimum nutrition.
Right.
And I want mom to be able, and this is really, one of the major tie-ins with Fit2B and some of the things that you guys do. I want mom to be able to not only safely deliver this little life into the world, but then to regain pelvic floor function afterwards.
Mm-hmm.
Right.
I want moms who are postpartum to understand that, it's never normal to, be 30 years old and wet your pants when you sneeze. That's not a normal thing.
Right.
But the focus being on function is so much more important than being on, what does the scale say today?
Yeah.
Or what do I look like, Beyonce's pregnancy photos? Well, probably not.
I'm not sure I want to.
But I'm not sure that's a good goal for you.
All I need is a team of Photoshop experts.
Exactly. And an army of personal trainers and my own dietitian. And
well, and as you know, and we now have studies that prove this, women can deliver safely even when they are obese.
Right.
They can be just as strong. And sometimes, in fact, more frequently than we thought, thanks to these studies revealing this, we bounce back better.
Right.
So, body mass index is not a good tell of how a woman will birth, and therefore it's not a good way to measure how she should be treated. I'm so glad you said that.
Right.
About, even mentioning her weight has really no bearing on her outcome. It really is, like you said, about can she have a healthy, strong birth?
Right.
And how do we support her in that?
Right, exactly. And I mean, maybe deviating off topic a little bit, and you can steer me back, Chris, if we need to. But I talk to so many women who are, quote unquote, overweight, who present with all these other problems that they've been told time and time again, well, that's just because you're heavy.
Right.
And 99 times out of 100, that's completely wrong.
Yep.
Right. What do you see? What do you see that's most common? Like what are people coming to with the wrong mindset most often?
In my world, it tends to be pelvic pain.
Okay.
Someone will come in, with sometimes years of crippling pelvic pain.
Wow.
Yeah.
And they've seen obstetricians or they've seen primary care providers who've just said, well, really this will resolve if you just lose 50 pounds. And I mean, just as an example, 2 weeks ago, I saw this gal, very sweet lady, on the heavier side, but irregular menstrual cycle, pelvic pain, and had been told again and again and again, well, it's just because you're heavy.
Wow.
Well, nobody had even bothered to do something as simple as get a pelvic ultrasound and look.
Oh.
And, here's this lady, she has this softball size ovarian cyst.
See?
That, it's not obvious on exam because of her size, but standard of care would be, well, listen to the patient, number one.
Right.
And, number two, do the workup regardless of what the person looks like.
Yeah. But that's what's happening. And that's, again, why I'm grateful that there's real studies being done and why the standard of care is shifting right now. And there's more awareness that you don't just judge a book by its cover, just like we talked about with males going into midwifery and assuming that because they're male, they wouldn't want to, or they shouldn't, or they can't, or whatever.
Yeah.
Looking at more blessed, as my mama would say, she just got more to love.
Mm-hmm.
Looking at somebody that has that and assuming, and we just have no right to do that. No right.
I don't want to just dog on the medical profession, but I think it's a theme that I think a lot of people would agree with that is common. It's almost a passing off Band-Aid approach. Here's a prescription kind of thing.
Right.
So for people that are listening to this and they're thinking to themselves that they're hearing this conversation, this part right here, and they're going, I feel like that's what's happening with my doctor or with my midwife or with the nurse that
I've just been told to lose weight, and
what should they do? Like, what's your advice to them? You know?
Such a good question.
Yeah, then that is a good question. The big thing to look for, and this sounds so simple in theory, but it's so difficult to find somebody who will do this in practice, and that is you're looking for somebody who's actually going to listen to you.
Mm-hmm. You're looking for somebody who's actually going to look and listen.
Right, exactly, right. And that means,
Sounds so obvious.
We have this kind of assembly line style of medicine that we're all kind of forced into. But when a client says, look, I'm having this problem, this is when you back away from the keyboard and you look at the person and you say, okay, tell me about it. Mm-hmm. What's really going on with you?
Yeah.
Yeah.
So it sounds like if you're a person and that's not happening, you need to give yourself permission to find a different healthcare provider.
Right.
Mm-hmm. And we talk about that a lot in that other video interview. We talk about what should midwives and OBGYNs be doing in the average appointment? How much time should they be giving? And we gave some awesome qualifiers in that.
Yeah. So if you are at that stage and you want more information on that, just pop over to Fit2B and search for Jacob and you'll find that. Mm-hmm. Also, we'll link to that in the podcast episode. You definitely need to do that. For sure, it's worth it. But just in a general sense, I think what I'm hearing is people need to give themselves permission to take ownership of their own body and care. And if they don't feel like they're getting care, the right care, they need to find it and change.
Mm-hmm.
Right. And this is, it's amazing that you still have to tell people this, but you do. Mm-hmm. When you go and see a healthcare provider, that person is working for you.
Right.
You say that in the girls' course, and it's so valuable.
Right.
While you also iterated in that course that girls should not need a pelvic exam until their early 20s unless something is wrong. And if something is wrong, we want them to be prepared. So you did this amazing video where you walked us through what would happen in a pelvic exam. Mm-hmm. But you were very clear that, hey, girls, as you grow up and you find somebody to work for you, that person is working for you.
Right.
Right. And don't be afraid to fire them if they're not doing a good job.
Mm-hmm.
Right.
Right. If you don't like the approach that, your midwife or your doctor is taking with your care, it's perfectly acceptable and not something that has to be a big deal to say, you know what, this just isn't working out. I'm going to go.
I'm not comfortable with this. Bye-bye.
Yeah. Exactly. No apologies needed. Think of me as, somebody that's been hired to do your lawn. Well, if I do a bad job mowing your lawn, it's okay to say, thanks, but no thanks. I don't want you back.
Right. I think that's a hard hurdle for a lot of people because they're in a position of a perceived position of weakness and submission, and this person with all of these degrees and things on their wall, they're the boss. And
that is what it feels like.
Yeah.
Right. And if you look, you can't see it on the camera, and I'm not going to do the swing the computer around thing, but right over here on my wall, I'm in one of my exam rooms right now. There's a big poster on the wall that says all patients have the right, and then a colon, and it lists the patient's rights in English and Spanish. And one of my favorites says all patients have the right to refuse, stop, or pause any examination for any reason at any time.
So good.
And I try and emphasize that with the patients, especially with people that are coming in maybe for their first PAP ever.
Right.
And say, you know what, if you're really uncomfortable with this, it's perfectly acceptable to call time out and say, you know what, either give me a break, I just need a minute, or I just can't do this today. The world doesn't end. We can reschedule, or you can see someone else. Nobody's feelings get hurt.
You would think that would, I'm so glad that you do that. You would think that would just be normal and standard, but I can tell you that what has happened to me is usually, hey, if it hurts, look up at the picture on the ceiling. Or, hey, if it hurts, just hold on tight to the bed. That's what I've been told. Not, hey, if it hurts, let us know, and we can stop and let you take a breath. My dentist says that, but not my OB.
Right, exactly.
I'm not seeing that OB anymore.
Yeah. I don't want to paint a picture that all doctors are bad.
No.
Because there's an amazing.
I have had a wonderful OB too.
Mm-hmm.
It's just that I think the message is you owe it to yourself to make sure you're getting the right kind of care, decent care. And like you said, if you're not, then you have the right to get that, and you should owe it to yourself to do that.
Yeah.
Exactly.
So many good things.
So Jacob, tying into fitness again, you see your patients, you work with them. What are the things they need to be thinking as they're going through this process, prenatal, postnatal? What are the things you've seen to be the most effective? What are the things that you wish you could, if you could just send a quick little message to all women that are going to go through this process, like what would that be?
Boy, I have a feeling this wouldn't be a quick message.
That's all right.
He could write a book or 10.
Right. Exactly. The big takeaways that I wish all of my patients understood about, fitness and pregnancy specifically would be, number one, if you're used to doing something, and you get pregnant, you don't have to necessarily stop. Let's just say you're a runner, right? Mm-hmm. And you run every day and you love it. It's your if you have kids especially, maybe it's your an hour of quiet time a day and you get away. Yeah. There's no reason to stop that just because you're pregnant now. Right? It's a little different if you've never exercised before and you get pregnant and then you say, well, I'm now going to train for a marathon and I want to run a marathon at 6 months. Well, maybe we want to pump the brakes a little bit. Yeah. But you don't have to stop exercising because you're pregnant. In fact, quite the opposite, right? Your body is training for the most athletic thing it will likely ever do. Mm-hmm. Right? You're about to push a human being through your pelvis.
or even if they have a C-section, that's still a lot of recovery.
That is still a ton of recovery. And you're going, even if you have a C-section, you're going to be carrying a human being in your pelvis for 10 months.
Yeah. Big deal.
That is a huge deal. And how you prepare for that really affects your recovery and really affects your quality of life later on.
But he takes a drink.
Right, exactly. I do want people to understand that pregnancy brings with it a lot of physiologic changes. And these are not necessarily intuitive. And by that I mean, let's just say you're on a desert island by yourself and somehow you find yourself pregnant and you have nobody to talk to. There are going to be things going on with your body that you don't understand.
Right.
We love to say, and it's really true, that women have been having babies for a very long time without our help.
Right.
And in the best kind of birth, really, as a midwife, I'm doing much more cheerleading than anything else. Right. Because the laboring woman is doing all of the work. Right. I'm just there. But there are things that change with your body with pregnancy that you may not fully understand. Right. For example, there's a hormone called relaxin that causes the ligaments that hold a lot of your bones together to get a little loosey-goosey. And this can happen relatively early on in pregnancy. All of a sudden you feel like, oh my goodness, why do my hips feel like they're going to fall apart when I walk? Or why does my back hurt? I'm not, because we think of back pain in pregnancy, we think of this big baby and gravity pulling against the lumbar curve of your spine. But really, you have a lot of hormonal relaxation of the ligaments that hold your spine nice and tight. Now all of a sudden they don't. And, here I am, I'm at 10 weeks and my back is killing me. Why is this happening?
Right.
This is where it's great to have, a place like Fit2B to send people to and say, you know what, almost every question that you could possibly have has been answered somewhere in there. And there are exercise routines specifically geared toward helping you exercise, not just exercise, to burn calories, but exercise safely.
Yeah. exercise with strategies to help those loosey-goosey ligaments not get more loosey-goosey.
Yes. That's a medical term, by the way, loosey-goosey.
Yeah.
Yes. Yes.
Oh, cool. I know medical terms. I knew that.
See?
Hey, you could be a midwife.
Right, exactly.
Oh, my goodness.
Oh, wow.
Yes, we would love to have any midwives are out there listening, or people who are considering becoming midwives, know that they have a partner who's going to work with them to help their clients have a healthy, safe birth, and that we are also an excellent fallback to, the person who is running and they're running just fine. And then all of a sudden they start having some issues. They start having some leaking, maybe even some prolapse issues. And, it's a place to kind of rebuild that fitness foundation so they can make a safe return to running when their body is ready. Because like you said, there's physiological changes that happen in pregnancy. We cannot stop. They are there to assist the pregnancy and assist the birth. We don't want to undo those things. So we want to have strategies in place to work with those things and support the process so that the mama can finish her pregnancy ready to make a reentry to what she loves. That's what matters to me.
I love that.
Yeah.
So Jacob, you have some, you're working at a clinic, you're doing this real life every day. It's real to you. It's not theoretical, even though you do have a lot of educational background for it. And you also create some resources for people that you're putting on Facebook. Should people, who's the target for that and how can they find it?
Right. So, the primary target, is obviously going to be our clients.
Okay.
But really anybody who just has an interest in what are the basics? Why is my midwife, ordering the tests they are? Or why are they telling me that I need a pap smear and how often do I need one and why? The videos that I post are very basic. They're designed to answer just those very simple questions. They're usually about 2 minutes long.
Yeah, they're really good.
Well, thank you.
I watch them and I'm like, oh yeah. Oh.
Yeah. I love that. So if people want to find it, they should look you up on Facebook. We'll also put the link to that in the show notes. Yeah.
We'll put the link to his clinic page in there.
Yeah.
Okay.
I think what I'm hearing overall, basically a couple of themes. One is, you owe it to yourself to make sure you understand what's happening. That you're not on an island by yourself. There are resources and you should find them and look them up. Even if it's not your first pregnancy, you need to spend time doing that. You shouldn't be afraid of fitness. There's lots of great resources out there. I'm partial to this website called Fit2B. You can look that up.
Yeah, me too.
But the internet, there are good resources on the internet, so you have no excuse to not find that stuff. And I'm also hearing that, you deserve good care. This is true for all seasons and all genders and all different types of medical care. It's not just about this particular thing we're talking about today. You deserve good care from a good provider, and you need to make sure you're getting that. If you're not getting that, you need to find a new provider, and you need to not feel guilty about doing that. And I think it's important. I think more people need to be aware of that and need to do that.
Yeah.
So
Agreed.
I love it. What else? Parting thoughts. This has been super informative to me. I love learning about this stuff. It's very cool.
Yeah. Really, if people could take away, one thing from why would I choose, a midwife over an obstetrician or a midwife over, an office-based gynecology practice to do my annual exams, that sort of thing.
Right.
Would be exactly kind of what Chris was touching on. Our training is much more geared toward things like patient autonomy. That is huge to us. We want to take the decisions, and this sounds strange until you think about it maybe, but we want to take the decisions largely out of our own hands, right? You come to me with a problem, and I'm going to present these are the options that I would recommend. There are about 3 or 4 good choices. I'm going to go over the pros and cons of each. And then I'm going to say, what would you like to do? This is your body. You're the one that has to live with the choice you make. What would you like to do here?
Yeah, I love that.
And you don't always get that, right?
Right.
So our commitment to patient autonomy combined with, maybe evidence-based care would be a good place to describe that, really kind of sets midwives, I think, apart from other providers.
Right.
That's awesome.
I love that. Well, thank you so much for your time today. This has been...
Yeah, thank you. I know your time is valuable and you have patients to see, and so it's just been awesome to have you.
No, thanks for having me, guys. This is great.
It's awesome. So if you are just subscribing to, or if you haven't subscribed to this, you need to subscribe to our podcast. If you haven't, do that right now. Click on the subscribe button. If you're seeing this on Facebook, you should subscribe to, or if you're seeing this on YouTube, I should say, it's not on Facebook. If it's on YouTube, if you're seeing it there, you should subscribe there. If you want more information about any of the sites we talked about in this, we're going to link all that in the podcast episode. You'll also find that on the website, fit2b.us or fit2b.com. And, this has been a very informative podcast. I love it. It's a good topic. It's a topic that touches a lot of people, and it's super cool to have you on. One of the 2% rocking it, certified nurse midwife. So it's very cool. Thank you. And until next time, we'll see you guys later.
Awesome. Bye, Jacob. Thanks for joining us.
Bye, guys. Thanks for having me. You too.
Bye, everybody.